Hello everyone, welcome to our channel today. Today we're going to discuss one case in Bell's palsy. We're going to discuss the symptoms, the cause, and the treatment, and also what we need to be careful for this kind of disease. Before we start, we're going to introduce what's Bell's palsy. For facial disorder, why the patient come to us, most of the conditions are the patient feel that the patient finds that they could not close their eye, the eyelid doesn't move, the eyebrow doesn't move, the forehead, the wrinkles, so they could not do this. And also one part, either the left side or the right side of the face, they can't move them. When they eat, the food will stay in a corner. And also some patients, they will drooping. So these are the main symptoms why the patient come to us. How the patient knows that they have this kind of matter, then they will seek for medical health. The actual cause of Bell's palsy is still unrevealed, but it is believed to be related to the inflammation of isolated nerves, especially in face region. Variety of the pathogens or causes cause inflammation and the swelling of the nerves. It will result in facial disorder. The cause might be virus infection or might be trauma. In Chinese medicine, the meridian, especially for Yangming meridian, the hand Yangming meridian and foot Yangming meridian, they all go to face. According to the symptoms of the patient in facial disorder, we thought that in Chinese medicine we believe that it is related to the meridian dysfunction of Yangming meridian. So when we treat this kind of patient, we also use the points that's related to Yangming points. It can either be hand Yangming points or foot Yangming. If the pathogen affects the meridian, it causes the blockage. It affects the circulation of the meridian on the face region. It will cause facial disorder. In facial disorder, it is recommended to accept the treatments. It can be either acupuncture or herbal medicine, and in most conditions, we actually combine acupuncture and herbal medicine for this issue. The patient is recommended to accept the treatment. The sooner the better, because after long-term damage of the nerves, if the nerves weren't recovered after long periods, it may easily cause the permanent sequelae, which is cause the permanent facial disorder. So it's recommended to accept the treatment, the sooner the better. In our daily life, we should avoid the cold condition. In Chinese medicine, the cause of facial disorder is due to the wind and the cold. Some patients, they also will tell you they got flu before the facial disorder happens. So the immune system also one of the main parts in Chinese medicine theories. Last month, we saw one case from our clinic. The patient was 27 years old and he got the facial disorder for half a year. So it happened last year, December. The main complaint when he came to me, he actually was complaining the voice. So he said that his speech is not as fluent as before, and the voice become funny. So it's not the normal voice he had before. During the consultation and physical examination, I found that the patient could not move his right part of his face, and right eyelid could not close properly, and the eyebrow couldn't move. As you can see from the picture, that's the condition before his treatment. When he came to me, also when he closed his eyes, the eyelid, the right eyelid, after he closed, would open automatically. So he got all those spontaneous movements in the eyelid he could not control, and the eyelids could not close properly. When we discussed more of his medical history, he was involved in a car accident in December. And after that, because this kind of problem, he could not move the face. So he believed that the face problem may relate to the car accident. But also, when we discussed, I found that he also got flu in December last year. So half a year ago, it's similar, it's more or less same time as he got this problem. So actually for the cause of this patient, I believe it is more related to the flu. For this situation, we use the combination of acupuncture and herbal medicine to treat this disease. The herbal medicine he's going to take twice a day, and acupuncture, we required him to come every day. So we will have the treatment done every day. As you can see from the picture, on the first day before the treatment, you can have the comparison of the eyes and the face. On the second day after the first treatment, the patient's eyelid can close better the second day before the treatment. And also you can see the picture during the acupuncture treatment, when we have the needles on the face, the eyelids even close better. When he come for the fifth treatment, the patient told me that the day before the fifth treatment, close your eye. When he come for the fifth treatment, the patient told me that the day before the fifth treatment, the face start to move again. The face on the right side start to move again, got a very mild movement. As you can see from the video, this video was taken on 24th of June 2019. This is during the 8th treatment. The face movement is almost normal, and the eye closed much better than before. In this patient, the formula we use is modified Qianzhengsan. Qianzhengsan we're going to discuss in the formula video later. That's the formula specifically for facial disorder, for different kinds of facial disorder. So no matter it's palsy or the other facial disorder, as long as it's not central nerve system, we will use Qianzhengsan. We also will modify Qianzhengsan. So it depends on what kinds of condition. After consultation, we will try to figure out the cause of the patient, the weak part of the patient. So in the formula and acupuncture treatment, we will modify them to treat the symptoms and to tonify the cause. So for the roots and symptoms, we treat them together. In this patient, the facial disorder happens half a year ago. It is actually not a good time to have the treatment done at this stage, because as we said before, for this kind of disease, anything related to nerves, neurological problem, anything related to nerves and muscles, the treatment should be applied, and the sooner the better. So especially in acute stage, if we can have the treatment done in acute stage, it will be much better, and the patient may recover much quicker. So this patient accepted the treatment after half year. We believe that there is some blood stasis in the meridian. So in the formula, we use Qianzheng San and we add Chuanxiong to improve the blood circulation. Also in Qianzheng San, we add Shu Di, we add Dangui, and also Baizi. These are the herbs to tonify the spleen and kidney. That's the actual cause of this patient. Why he had facial disorder? There might be the virus infection from the flu, but why if normal people, if they have flu, they don't have facial disorder? That's because their immune system is good. So this patient, we saw from the tongue and the pulse, we think that the immune system is not good due to the spleen and kidney deficiency. So we will use the herbal method to tonify the spleen and kidney. In this formula, Baizu was added. Baizu also the main herbs to tonify the spleen. During our practice, we have seen many cases of this kind of problem, Bell's palsy. The most of the patients really told me that I always will ask, especially for the local patients, I always will ask, why you wait until now? You came to us. They always will tell me that because the doctors told them that nerves problem is the progress and the repair of the nerve system is very slow. You need to be patient for this disease, which is partly true. For nerves problem, the recover speed is very slow. So sometimes it takes time. Sometimes it takes weeks. Sometimes it takes months before you can see the improvements. But also, it's not true that you need to wait there without doing anything. Disease is related to neurological problem and muscular problem, such as facial disorder, the one we were talking now, and stroke rehabilitation. After stroke, a patient got paralyzed. They couldn't move one side of their body, either the left or the right side. This is also related to the nerves. For this kind of disease, the patient is recommended to accept acupuncture and herbal medicine treatment. The sooner the better. As you can see from this case, the patient, the eyelid closed better after the first acupuncture treatment, and the face start to move after the fourth acupuncture treatment, and it almost become normal, especially for the face after the 8th acupuncture treatment. But I should say that everyone got very different response to the treatments, and also all diseases in every condition is different. So not everyone will achieve the same result as anyone else. So it will rather depend on your condition. In Chinese medicine, when we treat Bell's palsy or facial disorder, what we mainly concerned about is the root cause, which is the deficiency in different organs, especially in spleen, which is control the muscles, and the kidney. So in the formula, normally we will use something to tonify the spleen and kidney. According to the meridian theories, because the Yangming meridian, they go to the face area. So when we use the acupuncture treatments, we will put some needles locally on the face. Most of condition we will use the electronic acupuncture. And when we choose the acupuncture points, sometimes choose the distant points such as herbal. And because this is in Yangming meridian, sometimes we choose Zusanli, which is stomach 40. This is the main points to improve the spleen condition. Except the treatments, how can we prevent facial disorder happens? In Chinese medicine, we believe that facial disorder is related to wind and cold. So in our daily life, we should avoid good contact to wind and cold condition, especially cold temperature. So for instance, now it's winter now, we should keep warm. If in summer, it's very hot, if we use air condition, we should not allow the wind to blow to our body. Because the wind, especially for the cold wind, if they blow to our body, if your immune system, your body condition is weak, you will easily have this problem. In the other condition, especially for someone they drive for long distance. They drive for long distance and they always leave the window open and the wind blow to one side of the face directly. After a long time, sometimes when the driver arrived, they found that it's dripping. He got the facial disorder. That's also one of the reasons why in Chinese medicine we believe that facial disorder is related to wind and cold, because most of the patients, when you ask them to think back, they will have some history related to wind and cold, such as when they drive, they didn't close the car window, the wind blows on the face. Last year, we saw another facial disorder, Palsy. The patient had this problem. When we asked him, what's the cause? What did you do before this happened? The patient told me that they were in a party outside. They were in a party, they drink alcohol, and then it's cold as well. And the second morning, he got this problem. So as you can see from all these cases, there are some history related to cold and wind. So for facial disorder, to prevent facial disorder, we should avoid get contact directly to the wind and cold, especially in summer, like air condition or fan. You can make the room cool, doesn't matter, but do not allow the wind to blow to our body directly. If in a very unlucky condition, you will suffer from the problem. You can seek for Chinese medicine and acupuncture treatments as soon as you can. It will help you to recover the best. Thank you for watching our video today. For more information, you can visit our website. See you next time.